so nowadays I am seeing a trend. I do have examples for that. People getting some treatment from the traditional way, or the allopathy, from allopathy, and then later they are diverting to alternate therapies. So, for example,
Yes.
typical example is Steve Jobs himself.
Yes.
Yeah. So, how we should see this, or what is your recommendation, or what is your suggestion on this?
So, coming from the field of cancer, going through, reviewing literature, going through research, as well as understanding how drugs are approved and stuff, I will say I'm going to call what we're all doing as more like standard treatments that are proven on a basis of randomized clinical trials that included 500 to 5,000 patients. Sometimes even, you combine, like, do meta-analysis, put multiple clinical trial data together and come up with a plan of treatment. That's what we do. So we can give an idea of from a basic level of, hey, this is how a drug is developed. This is how we showed it worked in a preclinical laboratory model and in rats, for example. And then we tested this in humans, and then we tested this in a large population. And here is the data. Here is the success rate. Here is the safety. All these different data, which is important. So now allopathy, I'm sorry, when I say homeopathy and alternative therapies, unfortunately, they're not actually done in this manner. There's no phase 1, there's no phase 2 drug testing. They don't really go to the basics of, okay, what are you targeting? Okay, the cancer, are you targeting the cancer pathway? Or you cannot come up and just say, like, okay, I'm going to target every disease with one drug. I can treat, heart disease, I can treat headache, I can treat skin problems, So that's what I feel worries me when people come up with homeopathy and they say, oh, this drug, it'll cure everything. It's not like that. Like I just said, like lung cancer, I just said, like, how many types of lung cancer, breast cancer, how different is each breast cancer, how, and that example keeps going on, like lymphomas. There are, like, I can't count, like 20, 30 lymphomas. Each treatment is different. So one pill for everything is not reality. So yeah, Steve Jobs, actually, coming to his example, he actually went through all the standard treatments. And at a point when all these options were exhausted, he's a genius, right? He always wants to try. He said, okay, now I'm going to try these other things. Let me see how it works. And, I think it gives people comfort, to be honest with you, like leaning onto something, holding on to some hope, saying, okay, I'm going to try this. It gives me comfort. That's good, but I will tell my patients, hey, but don't ignore the standard treatments. Don't ignore your oncologist. Listen to them. They're not really giving you some random information.
Yeah. So, yeah, now the audience who is having some doubts in this regard, so they would have got a better clarity now.
Okay.
Yeah.